Well, welcome everyone, and thanks for taking some time to help to get to know our next president and CEO of Kensington Health. We kind of like these little fireside chats, and hopefully you will as well. They're kind of intimate and personal, and a lot like Kensington. So I hope you find this time helpful and well spent. So on behalf of the search committee and the board of directors, I'm pleased to introduce you to Adil Kalfran as our next CEO beginning February 1st, 2023. So then the question becomes, why did you choose Adil? And so, we had many applicants, over 100 expressions of interest and resumes sent forward. And with the help of our recruitment firm, Miriam's Becker, we reviewed them and went through a very thorough interviewing process that took a number of months. And I guess we really had, because this is the CEO role and president role, we had some key objectives that we were looking at that would be part of the basis of any CEO's role. And I'll just read those to you just so you have an understanding, because boards are weird things sometimes for outsiders. We only have one employee as the board of directors of Kensington Health, and you're looking at him. It's Adil, and effective February 1st. So it's important that we look at the needs of Kensington from a strategic standpoint, from a fiduciary standpoint, support the CEO, and become a helpful, thoughtful, knowledgeable sounding board for him or her to consider their strategies for the future. But at the end of the day, we only have the CEO to report to us, and of course, you as the Kensington team all will become very familiar with Adil as your CEO. But those key objectives, and I will read them. Number one is to ensure the stability of the organization post-pandemic, operationally and financially, to engage and lead a great team of healthcare professionals, to determine Kensington's strategic future in the context of a dynamic and evolving healthcare climate, including Ontario health team leadership, and also stewarding Kensington's capitalization strategy to unlock the value from Kensington's assets. And finally, the CEO needs to be able to develop innovative partnerships across sectors to achieve all of the items that I've just mentioned above. That said, that's sort of the formal rationale for objectives and so on that we'd be looking for. But what ultimately may have tipped the scales? You all know that Kensington at its heart is a residential and patient-focused community, and it always has been, and we have to ensure that that does not change. Adil, beyond all his other attributes, is a registered nurse, and nothing could be more in line with our personalized focus than that. So now, enough of me. I think it's time that we hear a little bit more from our friend, Adil. And maybe one thing I should do, Adil, is starting today, make sure that everybody pronounces your name correctly. And I won't even say other versions of it, because that'll might stick in somebody's mind. So how about over to you?
Sure. Well, I was taking copious notes on the reasons why. That's great. So I do pronounce my name as Adil, and thank you for asking. I really do appreciate that. For so much of my earlier years in Canada, people were pronouncing it as Adil, yeah. And then it morphed into Adil, and more recently with the way society is working and openness and understanding and empathy, I'm getting more people asking me about how do you pronounce it. So thank you, Jim. And so it is pronounced Adil. It's like an awe.
Well, now that we're on the right track, why don't you take a few minutes and tell the folks a little bit about yourself?
Sure. So I have to say, first and foremost, who I am is a father, a husband, and a son. And that's really, really important to me, because that it defines so much of my passion in healthcare. I am a registered nurse. I went into healthcare because I have a real passion for community development, and I see healthcare as a critical vehicle to develop society and communities around us. So a big part of my passion is about community development, and I use healthcare as a way for community development. And what does community development mean to me is really improving the quality of life of the people who live in that community. And that quality of life then also translates to how am I creating a society and a community that can nurture and support me, my family, my parents, my friends, our neighbors. So again, it becomes a multiplier from my main identity as father, husband, son, brother. So that's a little bit about me. I really, as usual, the main goal was go into medicine. And I thought to myself, I really liked the nursing aspect of healthcare, because it was very engaging to be with people that needed the care right there at all times, and being able to bridge both the medical side, the socio-demographic side, the personal family side, a very holistic way of looking at healthcare. I'm not saying that medicine doesn't do that. I think nursing affords you the time, energy, and approach to do it that way. So when I went into nursing, it opened up a whole new world to me. And through nursing, I discovered I didn't have to actually be just nursing. It allowed me to then think about community nursing and public health. And that's kind of why I went into nursing, and nursing opened the doors to so many aspects of community development. I realized that community development also needed some business sense as well. And so I started to have a passion for how can I bring in social enterprise to my passion. And so I went and did my health administration master's, and it led to an amazing career, both in Canada and internationally.
Terrific. We've had a lot of questions, and I should thank the community for responding so eloquently and in such volume. So we've tried to thematically work them through, and we've got we've set a number of them up, and Adil's going to answer and give his impressions of a number of them. We couldn't get to all of them, but hopefully we've captured thematically, as I say, the essence of the questions that came forward. So once again, our thanks for sending them through. I guess the first place to lead off is about you, and ask you about your personal mission statement. You've touched on that, but if you want to perhaps expand on it a bit.
I think for me, it's less of a statement and more about concepts that I really, really strive for. One is to focus on reducing disparities in the communities we serve, and seeking out collaborative relationships and partnerships to unlock the potential of the various components in our healthcare system together. And in order to do that, when we harness those strengths, how do we do it in a people-first manner? So if I was to go back to my mission statement, it's about equity, it's about collaboration, and it's about people first. Why are we in it? It's not about that PowerPoint deck. It's not about that line item on a spreadsheet. It's about people. It's about both the people we serve and the people we're working with to serve. And my mission statement is to bring those three aspects together in everything I do.
So would that sort of capture your the top three values that you try to demonstrate in your work?
A little bit, but I would say from a work perspective, the values that I hope that I work within and I inspire is about integrity, building that trust, that environment where we can believe in each other, as well as know that that person is there for the right reasons, collaboration, bar none for sure. And I would say accountability, and accountability to both what we are saying we're going to do, but also to what we need to be able to provide for the people we're working with and for. So I would say from a value statement, it would be integrity, collaboration, and accountability.
And just so everybody knows, what irritates you at work?
When people aren't using those values in everything they do. But more importantly, I think what irritates me is when people aren't willing to listen with an open mind. Things can change. We all have objectives, but I think listening and being empathetic to where a person is coming from with their opinion, idea, suggestion, or feedback is an important aspect of listening. In the culture and the society that we live in today, listening is even more important, because I think we're operating in a society that really, from a Canada perspective, exudes pluralism. And pluralism is a process of listening, understanding, discussing, having healthy challenges. You can't do that if you're closed-minded. Yeah. And I think it's the same thing that happens within healthcare, where health systems have advanced together, is when people appreciate where each other is coming from and seeing how we can harness one another's strengths and opportunities to really, again, serve people. And that's what it's about. And I think for me, if people aren't open to listening, it gets frustrating.
That's frustrating, yeah.
Yeah.
I'm going to read this question carefully so I don't miss anything, because again, we tried to collapse the sentiments of all the respondents. Your work experience is global, which is not uncommon among Canadian healthcare leaders, or which is not common amongst Canadian healthcare leaders. What led you to want to make that global move, and what brought you back? And what is something that we as a Canadian healthcare system can learn from other regions that you've worked in?
That's a fantastic question. I've always thought of Canada and Canadians and Canadian healthcare professionals as international, despite being in Canada. I think we've designed our systems over time to be more culturally sensitive, mindful of different perspectives. And as a nurse and as a leader, I've always sought out opportunities to continue to broaden my horizons and understand various cultures and health systems. I really enjoy health system planning and strategy. You can't do that if you're only looking at your own system. Right. So I did seek out opportunities to go abroad. So I did go abroad right after I graduated, and I worked in Pakistan with the Aga Khan Development Network, and at that time, the Canadian International Development Agency, on a fellowship in international development management. And I learned the system that I was born in. I was born in Pakistan. I came to Canada when I was 4. And throughout my upbringing as a first-generation Canadian, I always heard my parents say, this is how it was in Pakistan. This is how it is in Canada. And I needed to feel that for myself, not on just a visit. That's a different experience, but I wanted to go there and work, and I learned more. And through that experience, I said, wow, healthcare is truly universal and international. And so when another opportunity came to do international work through UHN and Princess Margaret Cancer Center to do a transformation project in the Middle East, I said, yeah, let's do that. I'm very lucky to have a very supportive wife, who's also in healthcare. Fazila has been an inspiration to me and a big supporter in us having an adventure internationally, not just for lifestyle, but also to learn and practice. And through those experiences, I've really learned that we do complain about the Canadian healthcare system, but relative to other systems, we're amazing.
Yeah.
And I think sometimes when you're in the system, you forget that, because over time we built expectations, right expectations. I think that that's part of being a citizen that wants more and in better ways. And coming from those systems has helped me understand where are our potential opportunities to make it better. How can we expand our network of thought leaders to help inform our system? So many contexts internationally from world-renowned centers that have helped inform my practice and bringing them to the table. We can't just think about our institution. We need to draw upon both local, national, and international knowledge to advance the healthcare system that we're operating for the people we serve again. And I also was shown where there could be many inequities. And so it has helped me understand, both from a cultural perspective, a health system perspective, how we can harness what we have now and make it better. I've learned tons. And while we had gone over to the various countries to work in, I think our institutions within Canada became richer for it. You know, oftentimes the Princess Margaret Cancer Centre would say, hey, we really learned the importance of more than just patient-centered care. What about patient and family-centered care? We really learned the importance of other healthcare professionals being practice leaders and informing internationally, not just the research physician. I think it's, again, coming back to the holistic nature of improving healthcare from multiple perspectives, multiple professions, and multiple cultures. And I think that's really helped me here. And being able to speak authentically about advancing various strategies, be it equity, inclusion, and diversity, seeing other systems where they've done well, where they haven't done well, seeing our system, and taking a long-term view about the progression and the journey that we need to go through to get there. I think that's afforded me a lot of patience, but then also afforded me a lot of passion to advance it. That international work has also helped me to really understand the importance of healthcare being a team-based sport, and team-based with the patient and their family, or their resident and their family and their community as part of that journey. Critical for that engagement to happen. We can't serve people if we can't listen to them.
Which in itself is very Canadian too. I think it was Dr. Sir William Osler that, who certainly in his day in the 1800s and early 1900s, became, among other things, very famous for listening, for teaching his students to listen to the patient. They'll give you the answer. The other thing I think is always interesting as Canadians is and speaking to your travel and your international experiences, that it really does help you. And if you have the opportunity to travel outside the country, it does help inform you as an individual about what it is to be Canadian, and you know, constant learning and constant better understanding of yourself. So that's about you. Let's move to working at Kensington. And to be fair, folks, he hasn't started yet, and he won't begin till February 1st. So there were some very good questions that we can't answer yet. It wouldn't be fair. We've just talked about listening, and I think that's what Adil wants to do. So before some of those questions are answered, I think he'll be chatting with you or with your colleagues. But that said, I will read this too. It has many different areas. What is your plan for getting an understanding of how they work and of how and of their various different nuances.
I have to begin, Jim, by thanking the questions that came through, right? They were very insightful and kind of gives us a flavor of various other engagements we need to do. I think nothing beats understanding an institution, agency, and organization than going right to the front line and connecting with both the patients, residents, as well as the frontline teams that are delivering the great care at Kensington. And I look forward to doing a series of engagements, one like just informal conversations about what's working well, what's not working well, where do we see the future going throughout the organization, and just to really understand the various cultures and opportunities that exist within Kensington. I think my predecessors have left a fantastic foundation to build from, and we're in a chapter where we should really be focusing on what are the opportunities with these fantastic assets and teams that are delivering great care. So expect a lot of coffee and donuts engagements with me and the team, and just an open and honest, friendly conversation. That's what I hope to do first, and to not only learn about the organization, but more importantly, learn about who's delivering this care, the frontline teams, knowing the names, and right now, you know, I did do a little bit of a tour 2 days ago, Jim, just an informal one with Terry, and he was such a fantastic host. Seeing a lot of eyes, because everybody's wearing masks, smiling, and so passionate about what they do, and just coming up and being so warm and welcoming. I hope to utilize that as an opportunity to continue throughout. And I have to say, I was I'm very interested to speak with the volunteers at Kensington. I think that will be my first stop, is going to the resident and volunteer councils to hear what's their passion, their why are they at Kensington, and see that what's resonating with them. So I look forward to doing that.
And I would just say to the community that that has been one of Adil's passions right from the beginning. Even in the interviewing process, you spoke of the volunteers and the importance of the volunteers, and we would be a very different place without them. Okay, as you may know, reading this question again, guys. As you may know, Kensington Health has taken a leadership role in bringing together organizational partners to form the Midwest Toronto Ontario Health Team. What do you see as the future direction of the OHTs, and what are the opportunities that exist for Kensington Health as the host site of the Secretariat and a unique provider of community-based care?
One of the things that I was really looking forward to when I decided to put my name forward for the competition at Kensington was the OHT. There's a lot of time, energy, excitement, belief, and will at the provincial scale, because I've come from Ontario Health, to realize the full potential of OHTs, Ontario Health Teams. And the reason why is, coming back to our original passion, we need to see the health system work together better for the patient, connecting that patient or resident or family to the appropriate service, right? And so much of our healthcare system now, while we have great outcomes, our experience hasn't necessarily been the best. And we're really looking at OHTs as a way to improve the healthcare experience, bring partners together throughout the entire health continuum. When I talk about health continuum, I mean right from primary care to screening, diagnostics, to actual procedures or service delivery, to continuous support and activation and wellness. OHTs present an opportunity to connect those pieces together at the local level. And through that connection, you're going to build a community and you're going to bring those services together. I think there's a real opportunity with OHTs to not only do that connection, but improve patient and family navigation in the system. And that's really, really, really important to me, is how are we informing the patient and resident or family about what needs to be done, how they can achieve it, and then how are we going to support them through that, right? We've been concentrating on health outcomes. We need to really think about health experience. And experience, I've learned that working abroad, you know, in one of my international pursuits, they had good outcomes. They had great talent to be able to produce it, but their consumers wanted to go abroad for the service because the experience they were having abroad was better than the fragmented experience they were receiving at home. And they were willing to pay for it. You know, they were getting sponsored for it. We have an opportunity with the fantastic health services we have in Canada relative to the rest of the world to connect it better. And I think OHTs present that opportunity. I see Kensington as an ally, as a partner, as a leader to help connect that. We're such an amazing ecosystem of long-term care, community health, ambulatory care, palliative care, hospice, like end to end. We have a fantastic ecosystem here within Kensington Health. And the time is now for us to demonstrate that leadership beyond what we've been doing already.
Terrific. Well, it is also a time of year of hope, and I think that's a very positive way of looking at it. Staff morale. Another group of questions. Staff morale and wellness is incredibly important. How do you plan to engage with staff members and continue to foster a warm, fun, and professional environment across the program areas?
You know, the last 2 years has been nothing but grueling, both physically, emotionally, and mentally for our staff. So I think first and foremost is to recognize the amazing work that has been done by all our providers and volunteers and families to look after the people we serve. And I think those personal engagements with teams to understand what we can do better in this next chapter is going to be critical. One of my main priorities, as we spoke about, Jim, in the interview process, was that we need to ensure that our teams feel supported and are well enough to deliver the fantastic care as we go forward. And we really need to focus on our team's wellness. And so I don't have the answers. I know the direction and priority, and I hope to really learn from our community and our staff to help inform what can be done going forward.
Okay, so you don't have all the answers, but no interview, if I can call that this fireside chat process, would be complete unless we had rapid fire questions, right?
Okay.
So you can't hide. 10 quickies. Tea or coffee?
Coffee.
Summer or winter?
Spring.
Before we did this, guys, he said he was binary. So I asked him if he liked tea in his coffee. Okay, so we got spring. Cats or dogs?
Dogs.
Pizza or burgers?
Shawarma.
I thought you were going to say submarine sandwiches because you used to make them in a Mr.
That's
Sub.
right. That's right. My parents had a Mr. Sub store in Waterloo. Made many subs.
Consumed many subs. Vacation or staycation?
Ooh, tough one. I would say vacation.
Night person or morning person?
All day, all night. I would say shoot. I can't. I this one's tough because
remember the part about binary, guys?
Yeah, I would say night person.
Train or airplane?
Airplane.
Smartphone or tablet?
Smartphone.
Instagram or Twitter?
Instagram.
books or movies?
Movies about books.
Oh my God. I'm not smart enough to come up with a retort. That's terrific. So community, Kensington, you now know more about Adil. You're beginning to get a picture of our new CEO, effective February 1st. This is the part I'm going to let Adil close. So I will take this opportunity to thank you all. As Adil has mentioned, this has been a grueling couple of years, but you've hung together well. See, Adil, you'll get to know that I always choke up, but it comes from a good place. So with that, I'll thank my fellow board members. I'll thank the Kensington community. And I'll also thank Terry Caputo for doing an admirable job of filling in the role as interim president and CEO. That's not easily done, and we thank him for it very much. So with that, and a tear in my eye, I will pass to you, Adil. Where you go.
Well, I have to say, first of all, thank you. But one of the things that really resonated with me is the passion of the board. And Jim, it's clear the board is so committed to realizing the vision, committed to the staff who have helped through such a difficult time, and really believe in what we're trying to do together. And I am so excited to be able to learn, to be able to serve our community. One quote that I always use, and you'll get very familiar with this, is if you want to go fast, go alone. If you want to go far, go together. And I can't wait to go far with Kensington and our community.
And we join you in that sentiment, Adil. Thank you very much.
Thank you.